Hi, my name's Bethany, and I'll be helping you make a medication management plan today. I know that you have been diagnosed with paranoid personality disorder, and that's keeping you from doing the things you'd like to do in your everyday life, so the doctor has put you on some medication. So I want to go over where to keep your medication first. We're going to keep the medication in a cabinet by itself or on a shelf in the cabinet by itself. You can organize your medication in a pill sorter such as this, where the amount of pills that you take each day can go in the corresponding day. So each day should have 4.5 pills. Those 4.5 pills include 2 Lipressor pills, which are high blood pressure pills, 2 carbamazepine pills, which are your behavior regulation pills, and a half of a risperidone pill, which helps with your paranoid thoughts. So you should have 4.5 pills in each one of these days. So it's very important to take this medication at the same time every day. So in order to do that, let's establish a morning routine. Your morning routine can begin with waking up, brushing your teeth, getting a shower, whatever you normally do. When you come out to eat breakfast, that's when you need to take your pills because all of your medication needs to be taken with food. Once you come out here, grab the medication out of its corresponding day and eat your breakfast like normal, but leave half a glass of liquid, whatever you're drinking, left after you eat so you can take your pills. Your pills can be taken with orange juice, milk, coffee, or water. After this, you just return the pill sorter back to the cabinet and you're done taking your medication for today. So in case your morning routine gets disrupted, let's make a backup plan. Our backup plan is going to involve making an alarm in your phone to take your pills each day. So if you go into your phone and hit the alarm, you can set whatever time you want, say 8 o'clock, to take your pills each day. If you scroll down, you can name the alarm, and please name the alarm, take medication with food, because you want to remind yourself to take it with food. While you're on this medication, you're going to need to attend doctor's appointments regularly. And I know that can be hard for you sometimes. So in order to devise a plan to help with that, I want you to schedule your appointments in advance while you're at your doctor's appointment. So after you go to the doctor, when you come out and talk to the nurse, schedule your appointments, 3 months in advance. And then right after you're done scheduling your appointments, call a trusted friend or a taxi service and set up transportation to those doctor's appointments. Because when time comes to go to the doctor appointment and you have to do it on your own, it's a lot harder to make yourself go to the doctor on your own than it is to have someone come and pick you up and take you. The same can be done going to the pharmacy if you feel that you need that. Additionally, if you make these appointments right after, while you're already at the doctor's office, you will already have the feeling that you've survived the doctor, and it won't be as scary to make the doctor appointment later after you've been out of the doctor's office for a while. Really quickly, I want to go over an emergency plan because it's very important to stick to the routine that we've just set up. So our emergency plan is if you've missed a dosage and you forgot to take your pills one day, if you remember later that day, take the pills as soon as you remember. However, if you forget to take the pills until the next day and you're about to take Monday's pills and you realize that you forgot to take Sunday's pills, do not take Sunday's pills. Do not take the skip dose. You do not want to double up on dosages. If you do take too much medication, you will feel very specific symptoms such as dizziness, racing heartbeat. Depending on what medication, it could be a slower heartbeat. You'll have trouble breathing and you might pass out. If you are feeling any of these symptoms, please call 911 or the poison control number, which is 1-800-222-1222. So in order to remember that, I think you should put the poison control number and the 911 emergency number and the symptoms in the cabinet along with your medication. In addition to putting the medication and the emergency plan in the cabinet, let's also make a medication key to help you keep motivated to take your pills. So the key could involve taking a picture of each separate pill and then writing next to each picture the dosage that you're supposed to take for each pill. And then after the dosage, write how that pill helps you. So write that Lopressor helps regulate your blood pressure, and write that carbamazepine helps control the paranoid behaviors, and risperidone helps control the paranoid thoughts. This can keep you motivated to keep taking your medication because it will remind you that it's benefiting you and not hurting you. That is all of the suggestions that I have. Please feel free to tweak this on your own. Thank you.